As a physician trained initially in Western medicine, I realized early on that Western medicine is a disease care system, not a healthcare system. We have few to no tools in Western medicine to prevent disease and are not taught how to keep people well and healthy. We are trained to treat disease, not prevent disease. In fact, nutrition, which most people understand to be a key to health and disease prevention, is barely taught at medical school. So what is disease prevention? In Western medicine, what we call disease prevention, pap smears and mammograms and certain blood tests, in actuality is early detection medicine. It is not preventive medicine. Not that I'm necessarily against all these tests, but they don't help prevent disease. They just pick some of them up a little earlier. Real prevention is teaching people how to stay well, how to make lifestyle choices that promote health and resilience so no one gets sick. It is not waiting for disease to happen and then treating it, even if it's early. So why does Western medicine fall short when it comes to disease prevention? It's because Western medicine evolved during a time when acute infectious diseases were the primary cause of suffering and death. Antibiotics were developed and had miraculous results. Someone had an infection, was given an antibiotic, and got better quickly if the drug worked. But in this day and age, times are very different. Acute infectious diseases are not as prevalent, and the problems we face today are chronic and cannot be traced to a single cause, but rather have many factors that could be contributing to them, from diet to lifestyle and the environment we live in. The one cause, one diagnosis, one drug model does not work for today's ills. Yet, we have extrapolated that same model to treat today's problems. So we give drugs to chronic problems which just suppress symptoms and do not deal with the underlying cause. The model is failing us miserably, and we definitely cannot rely on the current medical model to keep us healthy, because the model has no tools apart from drugs and surgery. It's an unfortunate reality, but it means one cannot rely on the medical system to keep us healthy and to help prevent disease. So we must take charge of our own health. I'm going to give you some tools to actually prevent disease so you can take charge of your own health. You need to, because you cannot rely on our medical system to help you prevent disease. But before we get into the specifics, I need you to understand a few basic concepts so you can understand why and what you are doing. It's a new and different way of thinking about health and disease.